It's a very, very bad epidemic that's going on.
It kind of came in a wave, it hit hard.
And you wonder, is there an end in sight? Is there ever going to be a change? Is there ever going to be a fix to this?
One overdose death of a human being is too much.
It's one of the most common drugs in Utah overdose deaths.
Fentanyl.
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 Anyone can get caught up in the tangled web of fentanyl. Anyone.
Deaths from the drug in Utah spiked 1,160% between 2014 and 2023.
The more I come to understand fentanyl itself, it's just a horrible, horrible thing to get away from once you've got that taste. And so, yeah, he just couldn't do it.
An extremely potent synthetic opioid, fentanyl is up to 50 times stronger than heroin and 100 times stronger than morphine. It's cheap to manufacture and easy to mix with other drugs.
So there's fentanyl in everything, and honestly, I almost expect that now when we do drug busts that there's fentanyl in whatever we got, just because that seems to be what they've done to make their product that much better.
Even the amount of fentanyl just the size of a few grains of sand can kill. And even though you might not know you've taken it, your time may be running out.
There's a lot of people who are opioid naive, we call it, meaning they don't have a high tolerance for opioids. And if fentanyl ends up in their supply, now there's a risk of they're very, very, very vulnerable to an overdose without knowing that they're using fentanyl at all.
As police and federal agents have increased their focus on fentanyl, they seized a record 2 million pills across the state last year.
Law enforcement is excited that we got that off the street, but the other side of it is that we're worried that we do still have that much fentanyl on the street in the state of Utah.
Fentanyl overdoses have declined since this peak, but experts say the issue is far from resolved.
For months, a team of Fox 13 News reporters has been focused on fentanyl,
Working to better understand the drug's impact on communities around the state and what's being done to address it.
We've reviewed dozens of court records involving fentanyl in Utah and interviewed more than 20 people, from family members whose loved ones died from overdoses to law enforcement and community groups trying to help people overcome addiction.
Over the next few weeks, we'll explain how prosecutors are responding to fentanyl, including going after the dealers who sold a Cedar City woman the drugs that led to her death.
So the fentanyl, took her like that.
We'll show you how a fire department is taking a novel approach in responding to overdoses.
We're averaging between 2 and 3 overdoses a day that our caregivers respond on, and that's just in Salt Lake City proper. That's not the Valley, that's just our jurisdiction. So extrapolate that data and figure out what that means for the state of Utah.
And explore why some rural communities have been hit so hard by the drug.
I think most everybody has friends or family that have had an overdose death. We all know people, so it strikes all of us.
We'll also explain what experts say you should have on hand to keep you and your loved ones safe.
It might not be for you. It might be for your loved one. It might be for your family. It might be for your neighbor.
And share efforts to educate kids about this deadly substance to make sure they never get addicted.
I think if we give them that potential, they can change their lives and the lives of everyone that they come into contact with.